Welcome to Du Bois Regional Medical Center's eHealth Update, coming to you from the studios of the IT Academy at Jeff Tech in cooperation with the students of the Digital Media Technology program and their instructor, Mr. Sam Matero. Welcome. Today's topic is breast cancer awareness, and in the studio with me today is Lori Rancic, Nurse Case Manager of the Women's Health Center of Du Bois, and Laura Adams, Director of the Honey Regional Cancer Center and also in charge of breast care services at Du Bois Regional Medical Center. Ladies, welcome. And thank you for coming today to talk about breast cancer awareness. Now, is this really something that we need to devote a show to? In this day and age, all of the media attention around cancer and women being well educated nowadays, do we really need to focus on breast cancer awareness?
Thank you, John. Yes, we absolutely do. What we notice and identify in our community is the need to get the message out. We hear a lot about the famous pink month, a lot of time, a lot of pink out there for the month of October. But we know through our resources in our Du Bois Regional Medical Center that we have a lot of opportunity in our community to educate women about prevention, detection, diagnosis, allow women the opportunity to be properly educated, let them know about the services we have within our organization. And that's our goal today, is to take this opportunity to get the message out to the women in our community.
Well, I know that at DRMC we devote a lot of resources to all facets of cancer, but a big part of that is breast cancer. And we go from the gamut of education to prevention to the screenings and the diagnosis, and then also the treatment. And two of our biggest resources are right here with the two of you. I know Lori has a lot to do with the very first part of that, the education part, and in turn, the prevention part. Lori, why don't you give us a little idea of what you do for breast care services?
Sure, John. My role as a case manager in women's health is to provide community-based education to women through individual programs or small groups, clear through events. And in doing that, we realize that women really do want to learn about their health. Oftentimes when they're in with their provider or in the hospital, their care is so complex and they get overwhelmed. So having the opportunity to talk with them one-on-one and teach them about breast health, it's about self-breast exam and talking to their doctors about that clinical exam and the importance of mammogram so it's reaching women individually, whether it's about breast health or any other facet of their health.
So let's give folks an idea of how common this is for women. I know a lot of people make assumptions as to where breast cancer ranks among all the cancers. There are the American Cancer Society has a month for every cancer that there is, I believe. And you hear a lot about lung cancer and, all those other cancers, but breast cancer really is one of the main ones that women need to be concerned about.
Absolutely, and we're going to take this opportunity to talk about some of these common risk factors and statistics. As you can see, most commonly diagnosed cancer for women is breast cancer. There's a 1 in 8 lifetime risk of developing breast cancer. It's the leading cause of death for women between ages 15 to 54. It's the leading cause of death for women between ages of 15 to 54. Lori and I would like to take an opportunity to talk about that statistic. If we just take a few minutes and really look at that between age 15 to 54, and some of our goals of educating the community, of prevention, of annual screenings, there's not a lot of people out there that would think that that is actually the age range for this to happen. Lori, let's talk a little bit about that age range and some of the prevention, the education that you provide to women about this, starting with the young age of the statistic of 15.
Yeah, sure, Laura. What's important to understand is many people, as you'll see on the next slide, it talks about the good news. Even though breast cancer diagnosis has increased, we're decreasing death rate related to breast cancer because we're teaching women about self-breast exam and breast health. And it's really important for women, even at the age of 15, to learn to know what their breasts are and feel like on a monthly basis because that field changes throughout their life. But they need to take this as a personal message. We hear about breast cancer happening, and we know that it might happen to the neighbor or my aunt or my sister or my friend, but they don't realize it can happen to them. So we want to instill this message at a very young age for women to get to know their breast, to feel comfortable talking about that, and to be educated in early detection as we look at survival rates increasing because women are informed.
Yeah, survival is a key word here because really breast cancer does not have to be, the proverbial death sentence. When you hear the word cancer, breast cancer is definitely a treatable cancer. It's something that if it's detected early enough can be cured.
Absolutely, John. This is one of those cancers that we have all the resources for, but early detection is the key of that. Finding those breast cancers through breast self-examination, through your clinical breast exam, as we'll discuss more in depth as the program goes on, and receiving your annual mammograms is the most important measure that we can have, because breast cancer is treatable, it's curable, and that's what we want to reach out to the women in our community, that the earlier it's diagnosed, it's curable.
Now, I think this slide was very interesting because when you think of skin cancer, everyone from a very young age learns that if you're going to be out in the sun, put on your your lotion.
Yes.
Your SPF is a very common term that maybe when we were growing up you didn't know, but you still knew that sunburns were bad for your skin and it led to skin cancer. I guess when I read this, I sort of thought that self-exam and annual mammograms are sort of like your SPF.
Absolutely. As with skin cancer, we go out to the community and we educate on slip, slap, and slop as far as your sunscreen. With the breast cancer statistics and prevention, what we go out and talk about is our SPF of breast cancer.
Right.
Breast self-examinations monthly, clinical breast exams annually by your physician, and our annual mammograms.
So locally, we've seen the national statistics. Locally, where do you believe, and again, I'm not asking you to cite specific numbers,
Sure.
but where do you feel locally we rank as far as the most common cancer? Where does breast cancer rank?
Breast cancer is one of our top 5 anatomical sites, areas of the body that we treat locally right here at Hawnee Regional Cancer Center, at Du Bois Regional Medical Center. It's actually one of the top 3. So we know that the incidence rates of breast cancer are out there nationwide, but in our own community. And those are the women that we can truly be reaching out and helping through our services.
Okay, so those are key facts. So 1 in 8.
1 in 8.
And in our region, it could be even greater, or we feel we're at least...
We feel that we're at least at the 1 in 8 statistic, and we look at that throughout our organization on an annual basis, and yes, the 1 in 8 is where we're coming in our Tri-County area.
Okay, so let's get right into the meat of this now. Breast cancer facts. What is breast cancer? Define what breast cancer is, because it's not only located in that part of your body.
Absolutely. It's a group of cancer cells that spreads from breast cancer. It occurs mostly in women, but can also occur in men. And most breast cancers can originate in cells that line the ducts. And we'll get into a little more about the anatomy as the program goes on. The exact cause of breast cancer remains unknown. Many risk factors have been identified, but it's still the cause of it is completely unknown at this time. And we're going to take an opportunity to have Lori talk a little bit more about men and breast cancer.
So the risk factors, there are 2 different kinds, obviously, and they may vary somewhat between men and women. But so we look, and this was something that I found very interesting. There were non-modifiable and modifiable risk factors. So Lori, can you speak to a little bit about what that means and what's the difference between those?
I think what's first important is to identify what is a risk factor. We hear about them not just for cancer, but for other diseases. And what does that really mean? Risk factors are simply something that increases your chance for getting a disease or a chronic condition, such as cancer. And it's not a diagnosis, it's not a matter of fact, it just increases your chances. We look at things that are non-modifiable. That means those are the things we cannot change. More women than men do get breast cancer. We can't change that, but don't eliminate that men can't get it. We also know that as we get older, even though we said younger women do get breast cancer. Reproductive factors, hormones. Some breast cancers are very sensitive to hormones. We can't change the hormones in our bodies. And then also family history. We can't change those genetics. But the things that we can change are those modifiable risk factors. And those are the things that we want to pay attention to. Watching our body weight and our lean body mass compared to our being morbidly obese, because increase in body fat tends to increase the risk for cancer.
Wow.
Yeah, so not just breast cancer, all cancers.
Absolutely.
So really, we really need to be paying attention to physical
and that's
activity.
what we call a modifiable
because
factor,
we can
because
change
we can
our
change
weight.
that.
Yes. Another one is, and how we do that is avoiding high fat in our diets and getting out and getting moving. When we talk about sedentary lifestyle, that means we're not moving. People who don't tend to get physical activity above and beyond their daily activities tend to be more at risk for cancers and chronic disease.
So that 20 minutes of exercise a day that Dr. Grayka keeps telling me I need to get, that is something that factors into many health risks, and obviously cancer is one of those.
It does. And when you talk about that physical activity, it doesn't have to be 20 minutes on a treadmill, in a gym. It can be standing up at your desk, just moving around 10 minutes in the morning and 10 minutes in the afternoon.
Okay.
So break it into 10 minutes. Make it modifiable. Change
Right.
the way you're moving. And then we look at hormones, and there's a lot of medications or, prescriptions that we are given that have hormones in. Estrogen replacement therapy for women who've had hysterectomies or who are going through menopause, or women on birth control or oral contraception. So we have to be mindful to risks that we can't change, family history, and if we start taking birth control pills or hormone replacement, that may increase our risk or our chance of developing breast cancer.
So it's not something artificial you're putting in your body. You're just changing those levels that are already in your body.
Correct.
Okay. So those are the risk factors, and again, when you look at those, it's something that as your risk factors, if you find yourself saying that, oh yeah, I have these things, then obviously your awareness to breast cancer needs to go up as well. And we're not saying that if you're not, you don't have a check mark on one of these lists, that you still don't have to pay attention to breast cancer. But we're just telling folks that if you have a check mark on this list of things that we're giving you, then you're a prime candidate for awareness, education, and the screenings.
Absolutely.
There's an interesting statistic on the next slide, John, if you could forward. It's remember, all women are at risk for breast cancer, but interestingly, 76% of women diagnosed with breast cancer don't have risk factors. So you don't use that as a solid rule. I don't have risks, I'm not going to get it. That's why our message has to be to every woman.
Right. When I read that, I was just shocked, because if you don't have a risk factor, then how do you know what you need to do? And so I guess that sort of ties in. My very first question to you is, do we really need awareness of breast cancer? If you don't have this risk factor, you might think that you're fine and you don't have to worry, but 76% of women who get diagnosed don't have any of those risk factors.
Don't have any of those risk factors. And we like to teach women that when you identify the risk factor, at this next bullet point is about the caution light. Utilize a risk factor, if you have one of those risk factors, as a caution light. It's not a definite diagnosis. It doesn't mean that you're sure to get it, but it's definitely a caution that you have to take. But we have that other major population percentile of women that had none of these risk factors. So that's where we come in about education and the importance of educating and how to take care of yourself. So we're going to get into a little bit more about that prevention, but On to the next slide, what we're going to definitely touch on here, and we want to make awareness on Lori's part, is about the men in our community.
Right.
And I will say, John, I've been a nurse for 30 years, and I've seen it in about 7 situations. So it is happening, and it's not happening away from here. It's happening here. And I think it's an important message. It's frightening. It's frightening for women, but for men it even brings on a different perspective because that's not considered a man's disease.
Right.
And so I think we can feel proud of our services at DRMC because they are recognizing its threat to men, and we have support services ready to help men deal with breast cancer diagnosis as well.
So even 1 in 100 still sounds like a good percentage of the population. To me, it does.
It does, absolutely. And as Lori talked about her clinical experience, I'll just back that up with my clinical experience through the years and the men that we have had the opportunity to share our services with, and how they also caution about screening and prevention to their next generation. So if they have a son, how to properly make sure that they're keeping up on their health. And as Lori talked about, our services have also catered at DRMC to the privacy of men, because this is not an easy disease for men to be diagnosed with. So we want to make sure that we can maintain and respect their privacy also. It's not always easy, as supportive as the men in our community are of the Pink Month.
Right.
It's not easy when you're going through it to come into an environment that's very feminine. So we make a lot of efforts throughout the breast care services line to maintain their dignity and their respect and their privacy. So we encourage you. There's multiple resources for you and phone numbers if you would have any questions that we can help the men in our community also.
And I think you remember several years back, we had a gentleman who was courageous enough to tell us his story.
Absolutely, John.
And he basically told me that, he bumped his chest and it was sore, and he thought that's, what it was. He bumped his chest with a car door, and when it didn't go away, he got concerned.
Yes.
And so he went to his doctor, and he came over and actually had a mammogram.
He did.
And discovered that it was breast cancer. And I see him all the time, so obviously, he's doing well. But he relayed to me that he is a very big advocate now for breast cancer in men, and he tells a lot of folks his story. And it's, you may think that you don't know somebody in our community, but you may know them, and you just don't realize it. So it's something, again, I'm sure most of the people today are watching this as women, but men need to pay attention as well. And if you're out there and you're a spouse and your husband says, I have this lump, don't discount breast cancer.
Absolutely, women. We can be their support in this matter if they come to you with that. And men, the message that we want to get out to you, because a lot of times this has a false perception. John mentioned this. We can do mammograms on men. The equipment has the capability, and we can screen and detect breast cancers in men the same as we can in women.
Now, do you see the men that are coming in are farther along with breast cancer, or do you see them coming in at the same levels? I mean, obviously, women have annual mammograms after a certain age. Men, it's not recommended that men have those annual mammograms, so there's a difference.
There is a difference, but no, we can't say that we're seeing it in later stage when men are diagnosed.
So that's a good sign.
That's
then.
a very good sign, yes.
In my experience, we look at the last bullet point. Signs are almost the same for women. And when we start talking about breast self-exam, that's what we're looking for, changes and signs or symptoms of breast cancer. And that is my experience, that men have had those signs the same as women.
Sure. And you mentioned earlier that there's a fear among men that this is a women's disease, but as we look at the next slide, there's also a fear with women, and I hear this all the time from women in my life. I don't want to have a mammogram because they might find something, and then I have cancer. I'm like, well, guess what? You have cancer either way. Knowing about it is way better off than not knowing about it in this case.
Education is power to our community, to our women, to our men. And we're going to talk a little bit more about that power that we can give them through education. As you mentioned, John, Lori is a huge resource to that. So we will get into how we can provide education and resources to the community.
Okay.
Yeah.
And we put this little slide on here because these are the keys. You have to make it a priority.
Absolutely. And Lori and I know, as well as every woman sitting out there today watching this, we're busy. We can make thousands of excuses why we shouldn't or why we can't do something on our to-do list. But let's go over our little Post-it note, Lori, and
Yeah.
discuss.
Yeah, do monthly self-exam. If nothing more, just to become comfortable with examining your own breasts and knowing what is normal versus abnormal, so that when you do find a change, you can bring that to your clinician. And the second thing is, don't forget your mammograms. When we have early detection, you can live a high-quality life, if we find that cancer early enough. I think about that couple minutes of a squeeze is worth a lifetime of health. So don't be afraid of it.
Okay, that's great. And this is a great place to take a break. When we come back, we're going to talk about the anatomy of a breast and some of the screening methods and mammograms and some services at Du Bois Regional Medical Center. And again, we are watching Du Bois Regional Medical Center's eHealth Update.
My name is Jeff Harrison, and I'm from Du Bois, Pennsylvania, and I have two sons here at Jeff Tech.
Parents know the value of an education that works.
Technical people are important to our society and our economy, and it's one way to work your way up. You have to get a good foundation. And I think technical training is where you get that. Where else are you going to get that? And this place is like a gem. It's like a diamond. It's like, wow, we have this in Reynoldsville, Pennsylvania.
Take a video tour online at jefftech.us. Looking for a great career in high technology? Whether you want to start your own business or go into college, the Digital Media Technology program at Jeff Tech offers the most advanced training and studio available in our region. Learn audio and video production, live web streaming, 3D animation, and special effects. Graphic and web design using pro software, Photoshop, Fireworks, Dreamweaver, and After Effects, InDesign, Premiere, Wirecast, and much more. Full-time and part-time enrollment options are available for high school students and even adults in our area.
These situations that I've seen here at Jeff Tech are purely hitting the college level. I mean, there are people who are waiting 4 years out of high school to go into 4 years of college to do the same things that the students here are doing right now. And so, needless to say, you want the jump start, this is the place to be.
Explore the Digital Media Technology program in the IT Academy at Jeff Tech. A whole new world of opportunity awaits you. Visit us online, dmtstudio.net.
Welcome back to Du Bois Regional Medical Center's eHealth Update, broadcasting from Jeff Tech in cooperation with Mr. Otero and the Digital Media Technology students. We welcome you back, and I am John Brennan from Du Bois Regional Medical Center. With me again is Lori Rancic and Laura Adams. And before we took a break, we were talking about breast cancer awareness, but now we want to talk a little bit about the anatomy of the breast. So, Laura, tell us a little bit about what it actually is.
Yes, with the anatomy of the breast and the importance of this is that women get to know, you've heard the message over and over, get comfortable with what your breasts feel like. What is normal for you, what is not normal for you. The breasts are made up of, let's think of it like different layers of the breast that you have to get familiar with. There's parts of the breast anatomically that are made up of lobules that are what produce the milk, have the milk producing glands, or ducts that carry the milk in our breasts. There's also different types of tissue, just like in our skin, that are made up of fatty or connective tissue. So when we talk about getting familiar with your breasts, every woman's breast is different, the anatomy of them. You have to get familiar with what your breast feels like. And on the next slide, what we're going to do is it kind of gives you what we call a cross-section of what the inside of the breast would look like, the different parts of the anatomy. And if you just pay attention to some of the different color coding, that will definitely fill you in on what the different parts can feel like. The yellow parts of the breast feel different than which is the fatty part of the breast, than what the insides of the breast would feel like with some of the thicker tissue. But again, the big importance is everyone's breast feels different. No two breasts are going to feel the same, and The importance is get to know what your breast feels like. So as we look through here and go to our next slide here, some of the areas that we really want to stress about is what's a woman's best chance against breast cancer is knowing how to monitor her own breasts and take the appropriate steps that we're going to talk about if a change would occur in what they feel like. So at this point of our presentation, what we want to get through are talking about some of the symptoms and what the breasts could feel like. So Lori's going to have a chance here to review some of the symptoms and the different feels of the breast tissue.
Thanks, Laura. Whenever we tell women about monthly self-breast exam, it's not just a quick feel and you're done. We really do teach what we call an evidence-based model for self-breast exam. That means it's gone through research and it's gone through clinical trials to be proven as a very effective way for women to find early detected nodules, lumps, lesions, cancers. What's important is that you look for changes, and whether they're changes when you are 15, when you are 55, or whenever you are 75. It's starting at that young age and doing it monthly. We always look at your cycles and hormones and time of the month. So you have to find a time at the month that you are comfortable doing that, but remaining consistent to that. And whenever we look at those changes that should occur, as you'll see on the next slide, as Laura said, there's lumps and bumps, and many people will get them, it may feel in the lobe, it might be in the lobule, it might be in the duct. These are all different parts of the breast, and that's where that lump may be originating from. But we also talk about symptoms, and what's important is these are changes that we want you to recognize. So whenever you go on to the next, we talk about something called nodularity characteristics. It's kind of a clinical term for lumps and bumps. And what these feel like, these are the feel symptoms. These are what you're going to feel in your breast as you're learning this exam.
So you're going to feel lumps and bumps.
You are.
Naturally.
And every woman is going to have lumps and bumps at some point in her life. And they are going to change, and that's the key, when they change, because a symptom of breast cancer is a change in the tissue of your breast. Okay. And this change may be swelling, it may be thickening, it may be something that you haven't felt before. It may be hard and rigid, it doesn't move very easily, it may be clustered, or it may be single. But another thing is some breasts tenderness, if you have increased tenderness, if you have drainage from your breast, those are other things that we want you to be familiar with other than just these lumps, bumps, or rod-shaped feelings in your breasts.
So then are there parts of your breast where you should really focus on then? I mean, it seems like you want to make sure you're comfortable everywhere. But are there places where you should pay particular attention?
You should, and the next slide pays attention to this. The location of the lumps that you're going to be feeling. Believe it or not, over half of breast cancers are found in the outer aspect, or in the arm, like kind of the armpit region. And
so most women probably don't even think of that as their breast.
No. So when we teach this evidence-based model of breast self-exam, we explore with women the importance of going beyond their breasts to an entire zone of palpation or touching, feeling, and monitoring. And that involves this, what we call the axillary tail, or on the outer portion underneath your arm. It's also important to feel below as well as close to your breastbone. So it's not just the breast itself. You also want to look for dimpling or changes in the appearance. So women not only have to feel comfortable touching their breasts, but looking at their breasts from various angles in front of a mirror.
And when Lori talked about different zones, that's some of the areas that we really want to stress. A lot of women feel that their breast exam should consist of just actually the mound of breast tissue that they have. But it goes beyond that. It's up into your armpit, around your armpit, and as far as to the sternum of your chest. And the women that find these breast cancers through their monthly breast self-examination, they're familiar with what something feels like. They may come into our service line and tell the technologists, it just feels different in this area. I went to my doctor and I told him it just feels different than it usually feels. But women, that's not always breast cancer. We want to caution you about that. A lot of times those are monthly changes that are happening due to our hormones that Lori reviewed. But the biggest point is the evidence-based technique that we have and that we teach will allow you to get familiar with every aspect that you should be examining on a monthly basis.
And that's not a bad thing. If you feel something different, you go to your doctor.
Absolutely.
There is no one that is going to look at you like you're crying wolf, right?
Absolutely not. Our physicians throughout our organization take this very serious. We know that we need to listen to women. We need to listen as healthcare providers when they say they feel something different or they're experiencing something different. Good point.
So, a mammogram is something that's very cost effective.
Absolutely.
It's something that is not invasive.
Nope.
And so it's worth doing that if you do feel some abnormality.
Yes.
What's important, John, is women who practice self-breast examination on a monthly basis can detect a smaller lump than a woman who does not become familiar with her breasts. And when we come out to the community and do those educations, we actually have a model that shows that. And some of the lesions that are found by women who do not practice monthly self-exam can be about, a golf ball size because they're not familiar with that, compared to a woman who practices monthly self-exam. They're much smaller.
And we're going to talk about later about what happens after the diagnosis, but obviously if a lump that you find is very small, then you need a much less invasive treatment course than one that is much larger. So, this slide says a woman who practices monthly exams between her clinical exams, which are with her physician.
Annually, yes.
And then also your annual mammogram. Those are the women who have the best chance of finding these changes early and fighting breast cancer.
Being cured from it. So that's our focus here.
Okay. So again, we're going to recap this because this is what the whole program is about, your best chance. And, we have a lot of qualified healthcare providers at DRMC, and I personally know most of the staff at Breast Care Services, and I know that they really care about their job and they care about the women that come in. So again, monthly self-exam, yearly exam by a healthcare provider, and mammography. Those are your 3 things that you could do to give you the greatest chance of security against breast cancer.
Success and treatment against breast cancer, absolutely. And again, our services at Breast Care Services, we go through the entire gamut, but what we're going to focus on right now and educate about is about mammography itself and mammograms. So when we think about mammograms, what is a mammogram? It's actually an x-ray of the breast tissue. Yes, we do have to compress the breast to do that. The breast is made up of tissue. We went through the anatomy. There is no bone structure in the breast, so it's all tissue. For us to get an x-ray quality image using very low dose radiation is to have to compress the breast. If the mammogram that we do does show something abnormal in your breast, your doctor, many times the doctor that reads the images may need something clearer, an additional film, an additional x-ray of the breast, or many times a breast ultrasound is done. And we provide all those services at DRMC Breast Care Services. Our next bullet point that we have is ask for a digital mammogram beginning at age 40. We provide state-of-the-art equipment at Breast Care Services. All of our mammography is done through digital imaging, and that compression does need to take place. Now, one technique that we have, and we're very fortunate that we use as a standard of care throughout Breast Care Services, while doing the mammogram, we use what's called a mammopad on every woman that comes in the center for a mammogram. And it's actually a little cushion that goes on the piece of equipment so that when you compress the breast, it softens the amount of compression, reduces the amount of pain and anxiety that a woman may feel. Many times women do not come in for their mammograms because of the fear of compression, that it's going to hurt. I can tell you, as John mentioned, we have a very specialized staff at Breast Care Services. All of them are specialized and certified in breast imaging. So we use a lot of healing techniques to get our women through the amount of discomfort that can take place. And I can tell you we have a very good success rate with the mammo pads, with the soft cushion of the breast. So again, an annual mammogram starting at age 40 and above. At Breast Care Services, we provide the digital mammography.
And we have to be very conscious. Now, we are speaking in general terms about Du Bois Regional Medical Center, but there are folks who may be watching us out over the web. And if you are not in Du Bois, we encourage you to speak to your physician. If you don't have a physician, find one. This is the best healthcare advice you can give a person, is they should have a physician that they can rely on. So if you're watching this anywhere other than Du Bois and you need to find out what your healthcare provider has in terms of breast care services, the standard is digital mammography, right, Laura?
Absolutely.
So most places should have digital mammography
And
at this
most
point.
places do, and there are several resources. Again, if you're watching this video clip and you're in a different area, we would be happy to assist you through our services finding another area, assisting you about how you can find a physician and request a digital mammogram.
So specifically, now back to Du Bois Regional Medical Center, we do have state-of-the-art digital mammography. You
Yes.
talked about the Mammo Pad. That's an added feature that we offer. I know that there are, I don't want to say little things, but there are things that your staff do that make it more comfortable. I know from what they call the capes,
Yes.
right down to how they get people in and out of the rooms and the dressing rooms and things like that. Those are all important factors in getting people in and getting their mammograms on an annual basis. One of the amazing features that I think we have at Du Bois Regional Medical Center is a nurse navigator. So would you address that a little bit?
I would be happy to. Along with Lori going out in our community as a nurse case manager and educating women, we are honored to have within our breast care services a nurse navigator. We have a nurse navigator who comes to us with 15 years of oncology experience, working alongside of medical oncologists. She staffs breast care services 5 days a week, Monday through Friday, and her job is to be there for women that have an abnormal mammogram or breast ultrasound. What she does is she'll sit with the patient, educate them on the results of their abnormal breast imaging. She will navigate them through any additional services that they may need, whether that's additional imaging or a breast biopsy, a surgical consult, and then through detection. If the woman is diagnosed with breast cancer, our nurse navigator is there to support the woman, to navigate her through the system. That may be coordinating appointments, providing one-on-one education to her and to her loved one, to her caregiver. Many times the spouse sitting on the other end of their wife finding or their significant other finding a breast cancer diagnosis. The nurse navigator is there for both the patient and their family. She works alongside of our surgeons closely to navigate them through and also to referrals for their treatment process if it is breast cancer. We also, within our services, we have support groups for the women that are diagnosed with breast cancer. We have a breast cancer support group that meets on a monthly basis over at Hawnee Regional Cancer Center once a month, and this group is a core group of women who get together, talk about latest breast cancer advancements. We bring newly diagnosed breast cancer patients into the support group if they would like that. We have additional support groups for the spouses that may need to join them. And what we have seen through the support group is that they're actually a resource for our newly diagnosed breast cancer patients. And it's been very successful. We have one of our RNs that's oncology certified that leads up our support group and facilitates it on a monthly basis. We also provide throughout the year free screening for women that are underinsured or have no insurance. This happens through the collaboration of Adagio Healthcare and Susan Komen, where we can get vouchers for women if you meet certain eligibility. So women, there are no reasons not to have your mammogram. If you don't have insurance, if you're underinsured, our nurse navigator, our nurse case manager can assist you with that in the community, setting you up with those resources. We annually devote one day in October every year to a free screening day where we have, again, the entire day is devoted to women that are underinsured or no insured to come in and have their mammograms done. And again, through Lori's participation, we have community education that we're available for social groups, church groups, one-on-one education in the community. Many of these services can be coordinated through our nurse navigator with one phone call to our center.
And you call breast care services, you call the Women's Health Center, 2 easy phone calls to make to get education brought to your community group, your women's club, your civic organization, your church group. It's endless. We could do a whole show on places that Lori has been to educate women about just this topic. So that gives us a good idea of what we are doing and the resources that Du Bois Regional Medical Center provides for breast care services. Okay, so I think at this point I would like to take another quick break, and we'll get back to the conclusion of our show. As we leave, I want to again thank our digital media technology students at Jeff Tech for letting us come in and do this. They're doing all the work. All we're doing is sitting here and talking. So we're going to give them one more opportunity to give you an idea the services that they can provide. And when we come back, we're going to talk about what happens after your diagnosis.
Looking for a great career in high technology? Whether you want to start your own business or go into college, the Digital Media Technology program at Jeff Tech offers the most advanced training and studio available in our region. Learn audio and video production, live web streaming, 3D animation and special effects, graphic and web design using Pro software, Photoshop, Fireworks, Dreamweaver, and After Effects, InDesign, Premiere, Wirecast, and much more. Full-time and part-time enrollment options are available for high school students and even adults in our area.
These situations that I've seen here at Jeff Tech are purely hitting the college level. I mean, there are people who are waiting 4 years out of high school to go into 4 years of college to do the same things that the students here are doing right now. And so, needless to say, you want the jump start, this is the place to be.
Explore the Digital Media Technology program in the IT Academy at Jeff Tech. A whole new world of opportunity awaits you. Visit us online, dmtstudio.net.
Going to schools such as Jeff Tech, I think, gives you a good foundation and opportunities that otherwise you wouldn't think of doing.
Parents know the value of an education that works.
I think if you look at salaries and you look at earning potential, management jobs, getting out of Jeff Tech, you already have a jump start. You're in demand. You can start earning money faster. It's like the turtle and the hare. I mean, you're the hare, baby, and you're ready to roll.
Take a video tour online at jefftech.us.
Welcome back to eHealth Update, brought to you by Du Bois Regional Medical Center in cooperation with the students of the Digital Media Technology program at Jeff Tech. We are talking about breast cancer awareness today, and if you're just joining us, we are the whole way to the point where you now have a diagnosis. And we're speaking about the nurse navigator at breast care services at DRMC. And I hear from people all the time how much they love Becky and how much they love that position, because it really is very comforting to know that you have someone there to hold your hand and guide you.
And Becky Pollinelli is our RN, our nurse navigator, that is available at breast care services 5 days a week, Monday through Friday. And how our service line works is if you are entering our department with an order for a diagnostic mammogram, so you have something abnormal that you either felt or your doctor felt or a symptom, you are provided with same-day results. And that's where our nurse navigator is engaged into a woman's care. This is a very healing, emotional aspect. Anxiety levels are very high with women at this point because, let's face it, women, when we find something in our breast or we're experiencing something new, we're convinced at that point, as the sole healthcare coordinators of our families and many times our friends, we have breast cancer. We're convinced of it. But that is the point that we want to make with breast abnormalities, breast lumps. Most of these changes in our breasts are benign. They are not cancer that's detected. Not all lumps, not all abnormal symptoms are breast cancer. Our nurse navigator gets women through this detection, this diagnosis. At the point where you have a diagnostic mammogram and you receive an abnormal result, our nurse navigator is there to navigate you through the health system. We have several indicators that we use in our department, and that is one of the standards that we set 8 years ago, was that we were going to provide detection to diagnosis in 7 days or under. And that is one of our goals that we have sustained with many improvements throughout the 7 years. So if detection to diagnosis in 7 days or under is not available in all nationwide, we take a lot of pride in that. We have had key physicians, key players throughout our organization engaged in making this performance improvement measure happen for the women of our community, because they deserve that.
And it really came about because everyone at DRMC understands the anxiety that's involved in an abnormal finding.
Absolutely, John. From administration that supports it to our key physician leaders that support it. So you come in for a mammogram, you have a detection of something abnormal. You have to have a minimally invasive biopsy, or you have to have a type of surgery done. We want all of that to happen in 7 days or under for our women in our community. So there isn't anxiety for them, for their loved one. Do I have breast cancer? Do I not? And then we want to make the navigation process happen through our nurse navigator of getting their appointment for additional resources such as surgery or into the cancer center. And that's where the nurse navigator is there to hold their hand, to be their emotional support through their abnormal diagnosis.
So you get your abnormal diagnosis. You meet with Becky. Becky says this is the next step. In most cases, it's not cancer.
Correct.
So at that, you have an ultrasound, or you do another diagnostic test. And so you're saying that within 7 days, that woman knows that it's not cancer.
Correct.
Okay, so at that point, most of the time there's no follow-up other than scheduling next year's
mammogram
test.
with their ordering physician and their monthly breast exams provided by themselves,
Okay.
and their clinical breast exam by their doctor.
So that's a good thing.
Absolutely.
So let's go to the other end of that. So you get your abnormal finding, you have your immediate follow-up where you're finding out what your next step is with Becky. Within 7 days, you get that result back, that it is a tumor. Now what happens?
Now Becky's going to assist you along with your surgeon that you're going to get your support and your appointment at a cancer center. At Du Bois Regional Medical Center, we have Honey Regional Cancer Center, and the patient is then referred to the cancer center, where at the Honey Regional Cancer Center we have specialized physicians in medical oncology, which are the physicians that oversee the chemotherapy part of treatment, radiation oncology, which are the radiation oncologists that oversee radiation. We have our breast cancer support group that meets monthly, and we have additional resources and support through Du Bois Regional Medical Center with avenues of, John, we believe, Lori and I have seen the evidence-based practices happen. With breast cancer, with any cancer, yes, we have to treat the cancer. That's where our medical oncology, our radiation oncology comes into place, but you have to treat the entire patient, the whole patient. That's patient-centered care. That's social services support, pastoral care support that's available for patients, nutritional services. At Honey Regional Cancer Center, we have all of these areas of expertise that come into the patient's care. We also have within our cancer center a beautiful boutique that's available to every woman going through medical hair loss. And it's a very private, feminine boutique that's set up. We have free wigs for women. There is no financial eligibility for this to happen. We collaborate and partner with the American Cancer Society as a wig bank. Any woman can come in and try on, be fitted for a wig, and we have many different samples of wigs. We have very many different trendy styles. They are very trendy. We have bandanas for women that are not interested in wigs. We have different hair garments. So we treat the whole patient, and that's the biggest part we find through medicine, through our experience of treating the whole patient and getting them through their fear, their anxiety, and maintaining their dignity through their diagnosis.
And again, this is another topic that we could do an entire show on, and I hope that we can come back again and do a show on the Honey Regional Cancer Center itself, because we are going to undergo some changes. We're going to upgrade our equipment, and that'll be something that we can come back again and talk about in the future, I think.
Oh, absolutely.
Okay, so this is where I'm going to turn to Lori.
All right.
Lori, the question is, what can you do?
Anybody who knows me and what I preach is just, be physically active, be nutritionally smart, fill your body with good foods, and be in the know about prevention of any disease. Know those risk factors and those symptoms, but also know about, as we're talking about breast cancer awareness and breast health, know about the importance of self-breast examination, a clinical breast exam. We kind of went over that a little, but that is talking to your doctor and saying, hey, I need you to feel my breasts, and do this exam for me. Don't sit in the chair with your shirt on through the whole thing. None of us like to do that, but ask for that gown so you're empowering yourself and your health. So talk to your doctors about the need for clinical self-breast exam. Okay. Know your family history. Talk about it with your loved ones. Hey, what did Grandma die from? What did Uncle Joe have? Whatever it is. And then finally, just those regular mammograms.
And being proactive.
Yeah.
As you said, you don't want to just sit there with your shirt on. You want to take an active role in your care, whether it's breast care or other types of care. You want to take an active role, speak up, talk to your doctor. Know your risk factors. You need to be involved in every aspect of this in order to make sure that you have the best possible outcome. Okay. Now there are resources here, but for those of you again on the web who are watching us, there are many websites out there, and all you really need to know is cancer. It's whether it's cancer.gov, cancer.org. There are many resources out there. Obviously, the American Cancer Society, most people can find an American Cancer Society office somewhere near their home, and no matter where you live, they're out there.
And John, I think it's really important that people get their information from valid and credible sites. So paying attention to the .govs and the .orgs is very important, because there's a lot of stuff out there that people are kind of self-diagnosing or trying to treat themselves medically on the web, when we really need them to be,
That's
getting
why I tell
solid
people
information.
You need a healthcare provider.
Absolutely.
You need a healthcare provider, whether it's a doctor, a nurse practitioner, a physician assistant. Go to someone in your community that you trust, who's affiliated with a good hospital, and has access to things like the Cancer Center and breast care services, and that's where you're going to be the safest. Okay, so locally, we do have some phone numbers, important phone numbers. Breast care services, a number that you need to know in order to get your mammogram. 375-4061. Women's Health Center, where Lori will most likely be the one picking up the phone, 371-9666. And the Honey Regional Cancer Center, 375-3535. If you can't remember phone numbers, drmc.org is the site where you can go to find all that information. And there are lists of phone numbers, lists of physicians. Hopefully you find everything you need right there. And if you've liked our show today, you can email us. You can call us, but our email is drmconline@drmc.org. Suggest topics. Tell us what you think of our show. We hope that we will hear from you. And again, as we close here, our friends at the Digital Media Technology Program have made this possible because, like I said, we are sitting here speaking into the cameras on their studio, and we've been very excited about making this project happen. I want to thank our guests today, Laura Adams, Lori Rancic.
Thank you,
I want to
John.
thank Mr. Otero and his students. And again, this is DRMC's eHealth Update, and we hope to bring you more shows in the future. Thank you very much.